Right, that was the general portrait of the COVID-19 situation across the globe over the past 24 hours. Now for a closer look at the events here on the local front, I have Kim Yeon-Seung in the studio. Yeon-Seung, welcome back.
Glad to be here, Sunny.
Right, so as I mentioned, there has been a surge in the number of serious COVID-19 cases here on the local front. How is this reality affecting our medical sector, Yeon-Seung?
Well, nationwide, there are fewer than 280 beds. The share of ICU beds in operation nationwide has dropped to under 80%, but more than 85% of beds are still full in the capital region.
And Yeon-Seung, how are authorities seeking to respond?
Well, they're really working to amp up the medical response in the country. Authorities pledged to secure 25,000 more hospital beds by January. These extra beds will help treat moderate to critical cases of COVID-19. Government authorities are also designating public hospitals, including the National Medical Center, Seoul Medical Center, and the Veterans Hospital as COVID-19 care facilities. Authorities also warned that non-emergency medical procedures may be pushed back to focus on handling the climbing COVID-19 infections. Take a listen to what the South Korean Prime Minister had to say earlier today.
First, we'll secure enough beds so that even when there's 10,000 COVID-19 patients a day, we can continue treating them. We'll also send extra help for the medical workers on the COVID-19 front lines.
Right, Yeon-Seung, so given plans to transform state hospitals into COVID-19 designated medical centers, what happens to non-COVID-19 patients who are currently admitted at these hospitals?
Well, Sunny, they're being moved to somewhere else. Some eyebrows were raised over this decision because these centers usually offer medical services to the underprivileged, but health authorities reassure the public that disruptions will be minimized in the process of transferring these patients to other available facilities.
Right. And are efforts also underway to boost the number of healthcare workers to attend to the growing number of patients?
Yes, exactly. With the additional beds and more hospitals, there needs to be more healthcare staff to operate them. Authorities are deploying more medical professionals to fill in the manpower gap in these healthcare sectors. They estimated that there needs to be an extra 1,200 people to fully man the expanded medical capacity. They're also sending military doctors to the front lines and training more than 250 nurses so that they're able to care for critically ill patients. Take a listen to the extra steps authorities are planning to take to help out the overburdened healthcare sector.
On top of that, we're going to send the medical staff that the Central Disaster Management Headquarters are currently recruiting. We're also going to make sure these hospitals have full-time workers rather than temporary workers.
Right. Now, Yeon-Seung, I'm sure you'll agree, but it looks like, it goes without saying that healthcare workers are facing or bearing the brunt of this pandemic.
Exactly. And South Korean government is acknowledging their hard work and efforts, and they're hoping to repay them in higher wages and more benefits. Health authorities in Wednesday's briefing said that they're raising the pay for public doctors and nurses, as well as military physicians who are manning the front lines of COVID-19. Korea's health minister also paid tribute to all the hard work and sacrifices that have been made by healthcare workers. Take a listen.
Your dedication and hard work is the spark of hope that saves our people. With utmost respect, the government will assist medical workers and respond to the difficulties they face.
Finally, Yeon-Seung, what's the latest on the Omicron front here in the country?
Right, so as for Omicron, there were 7 new cases detected in the country. This brings the total to 234 variant infections. Omicron cases have jumped 45-fold within just 20 days in South Korea. A new update on the Omicron tally will be announced this afternoon, but concerns are mounting as Jeollabuk-do province could become a new virus hotbed for the variant, following a cluster outbreak of 20 Omicron infections this week in the city of Iksan.
I see. Well, do keep us posted, Yeon-Seung. In the meantime, thank you for that. I'll see you back on Thursday.